Let's see. Hello, everybody on YouTube. This is Clear Vision Wednesday. I am Claudia Mühlenweg, your host. I am a natural vision improvement teacher based on the Bates method, and I'm also the creator of the Natural Clear Vision method. So let me make sure my sound is off. All right, sorry, I'm looking at my other monitor. So today we have a really interesting topic, which is glaucoma. And you might not have heard about glaucoma, or maybe you think glaucoma is nothing that concerns me because I don't have it. Glaucoma is called the silent vision killer. And I will do a little brief kind of explanation about glaucoma in the beginning, and then we will do this guided meditation. And I will tell you why we're doing a guided meditation and why that is so helpful for glaucoma, or if you have also higher intraocular pressure, which might not mean that you have glaucoma. So there's also the case of where you have what's called ocular hypertension, and it's not necessarily glaucoma. So we will look a little bit into the education or the information on that, and then we will do the guided meditation, and I will give you some tips on that as well. So I have a few slides that I have prepared. I have to just bring that up in a moment, and then we will have time for Q&A at the end. So we will do a little bit of a slideshow. We will do the meditation, and then when that's over, we will do a Q&A. So if there's any questions that you have, we can discuss that afterwards. I also put some resources into the show notes, some books I have here, and some things like an eye mask that you might want to use for the palming meditation. So let me share my slides, and let's get that going. So you should be able to see my slides. And I will play that right now. So go into play mode. So it should be nice and pretty. So I call this from pressure to peace, because glaucoma is a pressure or intraocular pressure related condition that leads to potentially blindness. I do want to make sure that my medical disclaimer that I'm, not an eye doctor, and I'm not replacing our traditional vision care or visits with an ophthalmologist's office, especially if you do have glaucoma or if it's in your family. This is really important. I'm teaching this from my own experience, education, and teaching for over a decade. So what is glaucoma? Glaucoma is a neurological disorder that slowly destroys the optic nerve, leading to a loss of peripheral vision and then potentially eventually complete blindness. So the optic nerve is that little, string that you see going from the eyeball to the visual cortex in the back of the brain. And basically, the danger with glaucoma is that you're not losing your vision in the center, like with macular degeneration, or you don't get a cloudiness like with cataracts. So you potentially, in a lot of cases, you don't even notice that you have vision loss, because it's pretty much in the beginning the peripheral field. And just quickly, I did another presentation on glaucoma. So this is just a really super short overview. We're not going to go into all the details. So you have we will link that under the show notes. But basically, there's a few tests that people do. The most common test is the intraocular pressure. It feels like a little bit of air on your eye when they do that. Then they do an optic nerve assessment if they see something more suspicious, a visual field assessment, which is a little bit more evolved. And then they also measure corneal thickness and the angle. And we will look at that in a moment. But your corneal thickness, will obviously affect the pressure in your eye, because let's say you had LASIK and your cornea is pretty thin, then high pressure might not show up because it's like an old water hose, right? But maybe you have a really thick cornea and the pressure shows up really high when it's not really that high. It's just a really thick cornea. So this is important, especially when it comes to ocular pressure. So the normal range for intraocular pressure is anywhere from 10 to 21 milligrams. And what's considered high is anything over that 21 millimeters. I don't even know what the exact unit is. I should know this. Or millimeters of mercury, that's what it is. So according to the Bright Focus Foundation, having eye pressures over 21 millimeters of mercury is not very common in a generally healthy population. And it's known that eye pressure tends to increase with age, since the drainage system of the eyes does not function as well in many elderly. The second aspect is that an optic nerve that is healthy can withstand a higher pressure than an optic nerve that is already unhealthy, right? So additionally, the IOP, which is the intraocular pressure, changes throughout your day, just like your blood pressure does, right? Or blood sugar, those levels always change. So, but all that said, a glaucoma is always related to eye pressure, either too high or sometimes even too low or normal pressure. So now there's also something called normal tension glaucoma, which we will look also at in a quick second. So it's important to get this checked regularly. And if you're like me and you don't go to the eye doctor very often, I would recommend, at least if you don't have any family history, every 10 years. But if you have a family history, you need to go twice a year to get checked for glaucoma. So the second assessment that they do is what I said, is that optic nerve assessment. And you can see here how with the extra pressure in the eye, how you see that optic disc where the optic nerve connects to the retina is cupped. It's instead of being flat, it becomes like a cup. It's kind of going deeper in. And I had in my other presentation, I have actual pictures of the eye, so you can see how that looks like in the different stages of glaucoma. This is really hard to see. So that's why going to an ophthalmologist versus an optometrist is really important, because they are trained to see these tiny, tiny subtle changes. It doesn't look like it looks like in this picture. And the eye doctor can actually only see the front of your optic nerve, which is kind of like if you ever cut off a cable, they can only see that the part where you cut it off. They don't see the part that you see in this drawing, right? So this is a picture from the friend of mine that I did the other presentation with. This is her actual optic visual field assessment. So she lost pretty much all of her upper peripheral vision at this point. And the crazy thing is, and this is what's so important and why it's called the silent killer, is that, this is, let's say you're driving, right? There's a crosswalk, there's a family crossing the crosswalk, you have healthy vision. So glaucoma, I used to think glaucoma looks like this, right? It's like you just have this tunnel vision. You clearly know that you need to move your head a lot to see everything, but no, glaucoma looks like this. It's basically, if you're a graphic designer, you know the content of where filter and Photoshop, it basically fills in, which is what I used to create this image pretty poorly. I just did it quickly. But basically, you might not even see the people in the crosswalk. Or if you're driving, here is the kid playing with this ball. When you have advanced glaucoma, it might look like this, right? So that's why it's so dangerous, because you don't even realize that you don't see things. And there's all kinds of different glaucoma. And again, we're not going into all the details in this presentation, but we differentiate between open angle and closed angle. And you can see that here, open angle, right there is like the angle between the iris, which is that pink part on top of the lens. There's enough space. There's just a blockage in that drainage system. But the closed angle is where the iris pushes forward, right? You see how that is really tiny, and that really affects the drainage through the trabecular meshwork. So you have a closed angle is often an emergency situation where the inner pressure in the eye goes up really fast, really high. And it's more, think of it more like a heart attack, right? So there could be a total block of the drainage. And we haven't really talked about the fluids, but in the front of the eye, you have aqueous humor, which is kind of similar to tears. And they will constantly get replenished from within the ciliary body, and then they drain. It's like, it's kind of, think of an irrigation system. It's not the same stale old water in your eyes. It's constantly replenished and exchanged. And if no aqueous humor or water comes in and nothing drains out, you can see it's like the water hose that's going to burst, right? So, and that increases that pressure that's so dangerous. Acute angle, a closed angle glaucoma is an emergency situation. You have to go immediately to the hospital or the eye doctor. And here's another picture of this. So see in the front where it says aqueous humor, that's that tear fluid that looks like the water. And if that doesn't drain to the trabecular meshwork, you create that blockage, you create that extra pressure that then goes to the whole eyeball. And obviously the whole eyeball will suffer, but the optic disc, the optic nerve is really the area where you create that damage. So glaucoma, while it is a pressure-related disease, it's really a disease of the optic nerve. Really, that's what happens. And that's what leads to that vision loss in the brain or in the peripheral vision. So I hope that makes sense so far. So when we look at I mentioned earlier, the normal tension glaucoma. So some of you might have, and that's what my friend had or has, her intraocular pressure wasn't elevated. It was just normal. However, they still have that optic nerve damage. And the problem here is that there is low blood flow to the optic nerve. So it's not so much the pressure, there's not enough nourishment of the nerves. And this is often related to low blood pressure. Like if you have cold hands, cold feet, if you tend to get migraine headaches, right? Those are all indications, we're always proud of low blood pressure, but if it's really low, that could also lead to that kind of normal attention glaucoma issue. So, so measuring that's where the visual field test comes in. But in my friend's case, she has a family history of glaucoma. So she already knew about it. But if you don't have family history, you might catch that really, really late if you have normal attention glaucoma, because visual field assessments are not usually done unless they have some kind of, belief or some kind of worry that there could be glaucoma related. So typical symptoms of glaucoma, which are also overlapping with other things, are red eyes, pain in your eyes, that kind of high pressure feeling. And, if you ever see those rainbows in your peripheral vision, kind of any of those kind of what could be easily confused with the ocular migraine, right? And I don't have statistics on the actual connection with ocular migraines and normal tension glaucoma. So often these acute angle attacks, right? When I said go to the emergency room, you're like, well, how do I know? What this happens, you have dilated pupils, So for instance, these attacks can take place when the pupil dilates. So when you're in a dark room or walking at night, in this case, the pressure can slowly increase in the back part of the eye. But because the angle in the front, remember, is so narrow that when the pupil dilates, the drainage becomes severely obstructed. So with a wider pupil, this is even more of a problem with that narrow angle or closed angle glaucoma. And then this pressure pushes the iris forward, like we saw earlier, the angle to narrow even further, eventually blocking off most or all of the drainage of fluids from the eyes, which in turn increases the eye pressure even more. So at that point, the cornea may become cloudy and the eye may become quite red. This can cause pain and sometimes so severe that it leads to nausea and vomiting, right? So finally, there's irreversible damage to the optic nerve. So that's where you see an eye doctor immediately. So just to clarify, these are like glaucoma attack symptoms. So if you once in a while have a rainbow, but you don't have any pressure feeling, you don't have any red eyes, like you don't have any of this, then that's not the same as an ocular migraine. There is a difference. But if you have all these symptoms together, you need to go to the doctor immediately or to the emergency room. Really, really important. So what causes glaucoma, right? We do know higher eye pressure, obviously, a family history of glaucoma. There's a higher risk if you have African or Hispanic ethnicity. If you have a thinner cornea, if you have what's called low ocular perfusion pressure, like that, exchange. If you have severe myopia, right? If nearsightedness, that's another reason to improve your nearsightedness. You're not only at a higher risk for macular degeneration, but also for glaucoma. Any eye injuries or surgeries. So sometimes when people have cataract surgery, that could also increase your risk of glaucoma. High or low blood pressure, like we talked about, type 2 diabetes, vitamin and nutrient deficiencies, and what I call a type A personality, kind of that, you're the perfectionist who always has to get things right. All ducks have to be in a row at all given times. That creates that pressure on yourself, right? That kind of doesn't mean that everybody gets glaucoma that has this personality, but you're at a higher risk, basically. So Louise Hay believed that glaucoma is related to Stony unforgiveness, pressure from long-standing hurts. You're not willing to forgive those people. You want revenge, you're angry, you're overwhelmed by all these things. And Dr. Ilse Strempel, I will talk about her a little bit more because I really love her books. She did a lot of research on glaucoma and also why we're doing a meditation practice. So she said in her book, under high pressure from outside or an inner drive, that inner perfectionism, right? Often overly sensitive or having a tendency toward anxiety and depression and not resolved conflicts. So, a lot of us might be like, well, that's me, right? I have anxiety, I have depression. So again, it doesn't mean that all of us that have these symptoms or feel that way have the super high risk for glaucoma. But they found with people that did have glaucoma that these symptoms very often persist or were like present, right? So it's not, what is it called? Not the causation, but it's like if you are that type of person, then maybe get a regular check or be more aware of these things. So traditional eye drops, traditional treatments for glaucoma, for high pressure glaucoma, are those IOP lowering eye drops. They usually create a decrease of like 20 to 25%. And they're expensive, they have side effects, but that's the only thing that the traditional eye care industry recommends or has kind of in the arsenal to deal with glaucoma, with that high pressure glaucoma. We're not going to talk more about low pressure here, but obviously any cardiovascular increase, any of that, you want to, get your blood flowing, all those things are obviously, and I don't think the eye care industry does anything if you have normal pressure glaucoma. It's really mostly for that high pressure. So we're going to talk about palming meditation. And before we get into that, we're going to start in just a moment. I want to cover a few things. First of all, palming, and palming is called some people call it cupping, but it means that it's a form of meditation where you cover your closed eyes with your cupped hand so that no light comes in. So it really creates a warmth, feeling of relaxation, kind of, being in a dark cave, really relaxing. If you do it, it's really important that you support your elbows. In the top left, that's something I would recommend for glaucoma, is probably laying down, but you might even do something, seated, and we call that hover palming. I will show that in a minute, but basically you want less pressure. Remember, if you have too much pressure, you don't want to press your hands into your eye or let your head drop down with its heavy weight of 10 to 12 pounds into your hands. So you might want to consider hover palming, where you just hover your hands over your face. And the reason, so Ilse Stempel did a lot of research in this, and I don't have all her stats, but she wrote about in her books. She started with, I think, what's called autogenous training in German. Then she started with hypnosis. And then she found people were resistant to learning this training or didn't want to be hypnotized. And she eventually combined a guided meditation with music therapy, and has, resources in her book. And I have a book with a CD. I just don't have a CD player anymore. But she found that that the inner ocular pressure dropped after this. And her meditations are 30 minutes long. But they also did a study, and it was in the Journal of Glaucoma. They did a study in 2019 where they put 2019, yes, they put people in two groups, and I don't remember how many people were in that study. And they had open angle glaucoma, so they didn't have that, closed angle one. And the first group just continued their eye drop medication. The second group obviously also continued their eye drop medication. However, they also added a 1 hour guided meditation practice for 3 weeks. So my meditation today is not going to be that long, but they did one. So for 1 hour, a daily guided specific meditation practice. And the first group had no changes in the IOP. And the second group, 75% of the second group that added that meditation every day reduced the intraocular pressure by another 25%. So definitely very clear benefits that we have now proof of that meditation. And I wish they would have done one with shorter meditation, because 1 hour is quite a lot of time commitment. But just know that this is super, super important. So relaxation is, that opposite of the, we talk about Stony unforgiveness, pressure, type A personality, always having all ducks in a row. So letting go is really, really important. And that's why meditating and palming with meditation especially is so beneficial. So just what I said earlier, you can also use, if you have glaucoma and you have high intraocular pressure, you could use like a really soft eye mask, but not one that's really tight, like one that's really soft, instead of using the hands. Or you can do the hover palming, which is where you hover your hands about, maybe half an inch. You basically just hover them, you can maybe lightly touch your face, but you're not really connecting your hands and your face. So I hope that makes sense. And now get into a comfortable position and we will begin our palming meditation. From pressure to peace, a guided palming meditation for glaucoma and other high pressure personalities. Hello and welcome. I am Claudia Mühlenweg, and I'm here to guide you through this relaxing meditation to help you release the pressure in your life. So sit down or lay down in a really comfortable position. You can either just close your eyes, or you can do something called palming, where you cover your closed eyes with your cupped hands. And if you have very high pressure in your space on your eyes, you can also hover your hands over your face so you're not directly touching your face. Or you can use a soft eye mask under your closed eyes. If you do the palming with the hands over your face, make sure that you have some type of elbow support so that your shoulders can relax fully and deeply. Now let's begin by taking a few deep breaths. Deep inhale through the nose and exhale through the mouth. 2 more times, just like this. Deep inhale through the nose and sighing it out. 1 more time. Deep breath in and sigh it out. Now continue to breathe in and out through your nose. And I just want you to know that there's no right or wrong way of doing this meditation. If at any time it doesn't feel good, it's okay to come out of the meditation and slowly open your eyes. However, I invite you to stay through the whole guided calming meditation. Now imagine you're sitting at the ocean and you're observing the waves coming in and out. And you can feel the sand under your feet, in your hands. And now imagine that with every wave coming onto shore, you're inhaling. And at the top, there's a little pause before that wave goes back into the ocean. And then just wait for the next wave or inhale to come onto shore. There's a slight pause. And then as you let the wave go back into the ocean, you're exhaling it all out. As long as it feels good before the next wave, the next inhale comes. So continue this for a little bit longer. An inhale is the wave coming to shore. And exhale, letting it go back into the ocean. Now, just like the ocean waves come and go and flow in and out, or up and down, the same happens in your eyes. So connect right now with your eyelids. Your eyelids are closed. They're pretty thick and they cover the cornea on the inside. So feel that connection of the eyelids to the cornea. And imagine there's a little bit of water right between those two aspects of your eyes. And then travel through the cornea to the dome shape inside of the cornea. So right now you're in that area where the aqueous humor, that kind of tear-like fluid, flushes and swishes around in front of your iris and behind your iris, before the lens, in front of the lens. So you be in that little pool and imagine that water. There's fresh water coming in, and then there's the water draining out through the trabecular meshwork out of your eyes. You might know that as tears. And then we travel further back through the iris to the lens, the clear lens that's so beautiful, clear, and feels like so vibrant and healthy. It's all surrounded by that beautiful fluid, that nourishing fluid. The ciliary body around the lens is completely relaxed. There's nothing to do, nothing to focus on right now. And then your journey takes you through the vitreous humor, which is more like a gel-like clear structure. It's a big area, so you're moving your attention around that big half circle of jello. And it's moist and lubricated. And at the outer edges, it connects to your retina. So there's a really great bond between your vitreous humor and your retina. They're firmly attached to each other. And then you're moving your attention to the optic disc. That's the space where you have no photoreceptor cells. It's the little tunnel that connects your retina to the optic nerve. So your attention now travels through the little hole of the optic disc into the optic nerve. And you're moving through the optic nerve. There's a crossing. Doesn't matter right now, you're just in one eye, and then it crosses over. You meet the optic nerves from the other eye, and you cross over, and you connect to the back of your head, to the optic, through the optic nerve to the visual cortex in the back of your head. And now feel that warmth and relaxation on the back of your skull. This is where you actually see. And now let your whole head completely relax. Now bring your attention to your senses. Notice the taste in your mouth. Maybe wiggle your tongue a little bit around your mouth. Notice all the saliva. And then move your attention to the sounds around you. And the smells. Now feel the touch of the air on your skin. And any images or colors arising in your inner visual field. All your senses are open and alive. Now let the sound of my voice be your guide and support in experiencing sensations throughout your body. As I name each area, you may feel sensations that are present or nothing in particular, but whatever you experience is just as it is in this moment. Mouth. Bring your attention to the sensations inside the mouth. The roof of the mouth, the floor, the inside cheeks, left and right, back of the throat, tongue. The entire mouth is a field of sensation. The ears, the left ear, the right ear, sensing both ears at the same time. The nose, welcoming the breath into the nose, left nostril, right nostril, both nostrils at the same time. The eyes, left eye, right eye, both eyes together. A field of radiant sensation and relaxation. Sensing your forehead, the scalp, the back of the head, the back of the neck, the top of the shoulders, left shoulder, left upper arm, forearm, wrist, left palm, fingers, the entire left arm, right shoulder, right upper arm, forearm, wrist, right palm, fingers, the entire right arm, both arms together as one field of sensation. Upper chest, upper back, middle chest, middle back, belly, lower back, the entire torso as a field of sensation. Left buttock, left hip, thigh, knee, left lower leg, foot, and toes, the entire left leg, right buttock, right hip, thigh, knee, right lower leg, foot, toes, the entire right leg, sensing both legs at the same time, sensing the entire front of the body, the entire back of the body, sensing the entire body, inside and outside, as a field of radiant sensation and relaxation. And be aware of all that is now present in your awareness. Feeling yourself as the one who is aware of everything that is present. Being an observer in this moment. First sensing what's present, then experiencing yourself as the field of awareness in which everything is coming and going and flowing easily and effortlessly. Now we will practice an energy exchange. I will give you a word on your inhale and another word on your exhale. Inhale, today. Exhale, yesterday. Bring in calmness. Exhale, confusion. Inhale, presence. Exhale, distraction. Inhale, stillness. Exhale, chaos. Lightness. And exhale, heaviness. Inhale, softness. Exhale, hardness. Inhale, acceptance. Exhale, resistance. Inhale, relaxation. Exhale, perfectionism. forgiveness, punishment, bring in tolerance, and let go of anger. Invite surrender, and let go of fighting. Inhale expansion, and let go of constriction. Clarity, and let go of overwhelm. Peace, conflict, wholeness, separation. Invite compassion, and let go of judgment. Inhale joy. Exhale suffering. Ease. And let go of effort. Flow. Letting go of blocking. Inhale love. And exhale fear. Inhale love. And exhale love back out. Now just notice love flowing in and out of you with every breath. Remembering that there's no right or wrong way of doing this, and that you're welcome to return to your breath at any time. And welcome a thought or belief that you sometimes fall into or take to be true about yourself. And if no thought or belief is arising, simply being with whatever is present. If there's a belief or thought present, as you hold this belief about yourself to be true, where and how do you feel it in your body? Sensing how this belief affects your whole body. Noticing any images, emotions, or thoughts that arise with this belief without trying to change anything. If it is helpful, bring to mind the opposite. And as you hold this opposite thought or belief about yourself to be true, how does that affect your body? Being present to your experience just as it is, without changing or trying to fix anything. Now become aware of pleasant sensations throughout your whole body, like pleasure, happiness, joy, or simply well-being and relaxation. Or remember or bring up an event in your mind that brings up feelings of joy and happiness. Invite that into your body, in your mind, into your eyes right now. Welcoming whatever emerges just as it is. Or perhaps experiencing joy as a glowing light around your heart. And this light now expanding throughout your entire body, flowing out into your torso, your arms and hands, into your eyes, into your whole head, your neck, your shoulders, down your whole body, back down into the pelvis, the legs and the feet. You can even imagine a whole circle of glowing lights flowing up the top of your body, from the feet all the way up, your torso, to your head, your eyes, crossing over the top of your head and flowing back down the back of your body. Your whole body radiating with light and joy. Dissolving into being a pure awareness itself, open and spacious. Being aware that everything is flowing and moving effortlessly and easily. And an awareness in which everything is welcome, just as it is. Now bring awareness and reflect upon all that has been or is now present. Sensations, emotions, beliefs, joy, well-being, relaxation, the experience of being pure awareness. Everything just as it is, yourself just as you are. Now, taking your time, keep your eyes closed, but transitioning to a more awake state of wakefulness, sensing the body, how the body is connected to whatever is supporting you, the room around you. Maybe if you're palming, you slowly remove the hands from your face, maybe wiggle your fingers and your toes a little bit. Keep your eyes closed. Take your time to reconnect with the world around you. Feeling the gratitude for everything you just experienced. The gratitude for taking the time to practice this deep relaxation of eyes, body, and mind. Welcoming and loving yourself. Experiencing yourself as a spacious, well-being, perfect being, just as it is, just as you are. And your whole self as a whole, healthy and perfect human being, just as you are. Yourself as an unchanging, spacious awareness in which everything is unfolding. And the understanding that you always know the perfect response to each moment as you stay connected to the present moment with ease and joy. All right, everybody. That's the end of our guided palming meditation. And I'm going to, hope that wasn't too abrupt and helpful. And I'm now looking at questions and see if there's anything on YouTube or here on Zoom. And I do have a few things I want to show with you. Let me look on YouTube. I'm just seeing, okay, dry eyes. Okay, there's no questions right now. There's just some comments about the intraocular pressure. I always want to say inner ocular pressure, but it's intraocular pressure. So a few resources, unless there's questions. And if there's questions, I will make sure to answer them. So this is a mask that I like. It's plastic, so that's not perfect. But what's nice, it's kind of very cushy, soft foam, and it blocks all the light completely. I use this when I fly. And so if you have glaucoma, also you can adjust it with Velcro straps here. So I'm not affiliated with this company, but for glaucoma, the hover palming I was describing is basically, I don't know if I can see, but it's like you're not touching, you're just hovering your hands. You don't have to do it that way, but you don't want to, really press hard. That's what my message is about. And sometimes laying down is actually really relaxing. And so an eye mask like this, a regular, like soft eye mask might not block all the light, but this one really makes everything completely black, which is really nice for that relaxation. And I have a few books. I have them all listed underneath. So I have 2 books that unfortunately, they're only available in German. So unless you speak German, they're not really helpful. These are the 2 books. This is it's called Don't Be Afraid of, they call it Grüner Star in German, Glaucoma. And then this is called the Different Eye Book. This is the older version. Her covers now look like this. And I listed everything underneath. So you would have to get those from Amazon in Germany, unfortunately. And she has this meditation as a CD in the back. And then there's another book that I really also like, and that is gratefully, I'm grateful, available in English by Dr. Joseph Flemmer. And he wrote a book on glaucoma. It says a guide for patients, an introduction for care providers, a quick reference. And there's a quick reference. So this is a really great book, lots of pictures in there, really gives you an idea. It has some more graphic pictures. I don't want to show them right now. But yeah, it's really important with glaucoma and with students that I have. That's why my 21-day program is such a great resource. And I would put that in the show notes as well, because my 21 days to better eyesight experience is all about learning to relax eyes, body, and mind with breath practices. So if you already practice some form of yoga nidra, or if you do some breath practices, like I teach the diaphragm vacuum to really, because with low or normal, I would say low, but normal tension glaucoma, there's a lack of blood flow, right? So increasing your capacity to breathe and, getting the nourishment to the nerves is really important, as it is for the most glaucoma is high pressure. So for the high pressure glaucoma, it's about, what my daughters would call just chill out, easier said than done. So I'm definitely falling into that category of perfectionism, which often comes from not feeling good enough. And I've made huge changes to my lifestyle and my life and how I see things. But it's sometimes hard to break habits. So if you find yourself being that person, one thing you can do is forgive people. Like at the end of the day, it doesn't matter who's right or wrong. It's just about who are you punishing by not forgiving somebody? You're really punishing yourself. And so I've gotten really, really good at that. And with other things, like, it's work in progress. So I did get a check and I don't have glaucoma. So I just want to really make that, say that really important message. I, like a lot of my students, we don't like to go to doctors a lot, especially if it's, wellness visits. But if you're older, or if you have any risk of glaucoma, or if you're that kind of high pressure, like always have to get stuff done and the perfectionism and being all overwhelmed, then maybe do yourself a favor and go to an ophthalmologist and get that checked out, because I teach vision improvement. I don't want you to get a prescription for stronger glasses, but getting that stuff checked out before you notice. Remember those images. You don't know that your peripheral is gone. It's not the black tunnel. You don't know that you're losing all that vision. And that's why glaucoma is so scary and such a silent vision killer. And not everybody ends in blindness, but a lot of people that do not get that treated. And I never say the eye drops are very important, but adding that layer of the relaxation, the mindfulness, the meditation is really important. Qigong, Tai Chi, all those kind of practices that have movement with relaxation and mindfulness are really, really good as well. So you don't have to, if you don't like meditating, you can do other things, but really get into that relaxed state is really important to reduce that pressure. So don't just rely on the eye drops and keep pushing like you always did, right? Let me look if there's questions. Yeah, Danny, you're so welcome. Yeah, glaucoma is one of those things that, I remember seeing the ads in the metro when I grew up in Germany, right? For like, again, they call it Grauer and Grüner Star in German, which is green and gray. I don't even know what that means. Star means, star. It's like, but I don't honestly have no idea why they name it so weirdly. But it's a dangerous disease. And I had a woman contact me a few years ago. She went completely blind within a year from glaucoma, and she was in the care of the top-notch, Jules Stein ophthalmologist, here in Los Angeles. And but she was that high pressure person, and she had high blood pressure, and her doctors kept saying that has nothing to do with it. So definitely take the eye drops, really important. I'm not telling you not to take the eye drops if you have high pressure, but add those other layers in, and so that's what traditional eye care really ignores a lot of times. They don't pay attention to the holistic approaches. Burning eyes. Oh, that's so happy. I'm so happy to hear that. So Danny says her eyes are not burning. Yeah, we will, if you're in any of my programs, and not in any, but if you're in the Naturally Clear Vision program in my Clear Vision Club, we will cut this up and create a guided meditation. We will add some music to this so that anybody in my programs, it's not in the 21-day program, you get a different calming meditation in there, but it is, this will be added to my calming meditation. So we will cut this up without the intro and without this stuff, so that you have the exact calming meditation that you can use and replay as many times as you like. So if you're interested in my programs, reach out to me or post a comment or send an email to support@myholisticvision. You can also find everything on my website, myholisticvision.com. The next 21-day program starts May 1st. That's my introductory program. And that's a really great program to get started. If you're not sure if you want to do natural eyesight improvement, maybe you have a cataract surgery coming up, because this is another question I get a lot is, well, I have surgery, why do I need this? So if you don't do anything, if you don't address the root cause of your cataracts or your glaucoma or your macular degeneration or your vision problems, your myopia or farsightedness, whatever it is, astigmatism, like no surgery in the world will keep your vision perfect for like maybe if you're lucky for 10 years. With cataract surgery, it's usually a lot less. And so learning these natural approaches and learning how to use the eyes the way they were designed to be used is really going to keep your vision in top shape, even if you had to get surgery for something, right? So I'm never saying this or that. It's always, a lot of times, it's both. We have to combine both the traditional methods, which are, especially in cases of eye disease, you don't want to play around with that and not do those things, especially with intraocular pressure. You've now seen it can go really quick with glaucoma. And I'm sure the woman that called me had narrow angle glaucoma or the closed angle. But especially if you have those symptoms, headaches, rainbows, pressure, then and blurriness or cloudiness, then immediately don't wait. This is my message here today. All right, you guys, I don't see any questions, so I'm going to close the YouTube live. We have a great guest speaker next week. Elisa, I can't pronounce her long last name. She's a chiropractor, and she's going to talk about how chiropractic adjustments can really help your vision. And now I see a bunch of questions coming in. All right, okay. Yeah, so Karen said mine is genetics. So that's why the meditation, yes. This is the thing. It's not like when you have a condition, there's no fix. It's not like you can miraculously grow all your peripheral cells back. No, because it's not the cells in the retina that are destroyed in glaucoma. Remember, it's the optic nerve. And I have a book called Healthy Eyes, which talks about nutrition, which nutrients, that's why a good diet is so important. And I'm not getting into that this time. But he compared it to rats in New York underground. And I was always saying we had guinea pigs when we were little, and the guinea pigs like to chew on cables. So think of glaucoma as, that guinea pig, probably more cute than a rat, gnawing away on your optic nerve, which is the kind of that cable that connects your eyes to the brain. That's why you have that vision loss, not because some cells in the retina are suddenly like going dead. No. The cells in the retina are fine, but they don't transmit anything to the brain, or they try to transmit, and then it's like a blocked signal. So that's why it's an optic nerve disease. That's what glaucoma is, and it's caused by pressure problems in your eye, either too high or too low, or the pressure, if it's normal, then it's the pressure in the eye is not the problem, but it's the nourishment of the optic nerve and all the nerves in the body. So if you're one of those people with super low blood pressure, cold hands, cold feet, all those kind of things, migraines, then, get checked, because you're the kind of person who slips under the radar because your intraocular pressure is normal and the eye doctor doesn't think anything of it, right? So they don't usually take your blood pressure. That's what I'm saying. You have to be your own, what do you call it? Guardian of your own health. You are in charge of your health. Don't, rely on doctors. We don't wait for a doctor to tell you something is wrong. All right, I'm going to come to a close. So thank you so much for being here. I'm going to hang out with my Clear Vision Club members for a little bit longer. And otherwise, I'll see you next week for Clear Vision Wednesday. It's here every week. Subscribe to my YouTube channel. And I really appreciate any comments. I do my best to answer them. And otherwise, maybe I see you in one of my programs. All right. Bye, everybody.